Hi everyone, welcome to Lesson 3, Pressure Ulcers. What is pressure ulcers? Well, it's an injury to the skin and underlying tissue primarily caused by the prolonged pressure on the skin. So this is the stages of the pressure ulcer. Stage 1, non-bleachable erythema of intact skin. In Stage 2, partial thickness skin loss involving the epidermis or dermis, lesion may be present as abrasion, blister or superficial ulcer. In Stage 3, full thickness skin loss may be extended to, but not through the fascia, the ulcer may be endemic. And in Stage 4, full thickness skin loss involving deeper structure, such as muscle, bone or joint structures. And there is also unstageable ulcer, or known as depth unknown, that refer to the full thickness tissue loss in which the base of the ulcer is covered by a slough or a scar in the wound bed. Next, we go to the risk factors. They have internal risk factor that include all in the list, and also the external risk factor, as you can see here. Next, we go to the common sites of pressure ulcer. They include sacrum, lateral malleoli, ischial tuberosity, greater trochanter, and heels. For physiotropy assessment, number 1, identification of pressure ulcer that may be served as an occult focus for infection. Number 2, look for signs of soft tissue involvement such as warm, erythema, local tenderness, purulent discharge, and presence of foul odor. Number 4, because it's of associated comorbidities and advanced age, systemic signs such as fever and leukocyte may be minimal or absent, and even local signs of inflammation may be not obvious. And number 4, one should assess for the presence of exudate, odor, sinus tract, necrosis or oscar formation, tunneling, undermining infections, healing, and wound margins. And number 5, the staging of ulcer should be done accordingly. Number 6, nutritional assessment is important as patients who malnutritious have more bony prominence and therefore are greater risk for pressure ulcer. Number 7, microlobal evaluation should be done with an aim to distinguish between bacterial invasion and colonization. Number 8, blood culture or cultures of deep tissue biopsy specimen generally are more clinically significant than one cultures of superficial of the pressure ulcer. And number 9, imaging studies are useful in the evaluations of pressure ulcer for determination of the presence of osteomyelitis and declinations of the extent of deep tissue involvement. It includes plain radiography, CT scan, MRI, and radioclonide scintigraphy. For physiotherapy aims and treatment, physio aim to consider the local wound area and prevention and improve overall quality of life. Specifically, number 1, increase circulation to ulcer area to promote healing process. Number 2, minimize any risk of infections. Number 3, reduce edema. And number 4, prevent adhesion of wounds to underlying tissues. For physiotherapy treatment, positioning every 2 hours on bed and every 15 minutes on sitting. And soft tissue technique that involve slow deep effleurage and deep kneading, deep manipulation, UVR, ultrasound, and laser. And number 4, multi-component exercises that comprise of passive ROM exercises, re-education of walking with more emphasis on push-off, active assisted SLR, ankle pumping exercise, strengthening exercise, and teaching corrective measures. Alright everyone, thank you. So don't forget to scan this QR code for taking your quiz and practical session. Bye!